recent class of 2018. Today I will be going over chapter 22 and 23. In this video I'll focus on anatomy briefly and developmental components of the muscular skeletal system. This is 11 pages of a lot of things relevant. I don't know about everything relevant. So yeah, I think it's more like 20 pages now. So first off, I would like to say that I can do all things through Christ who brings me strength, Philippians 4:13. And you really can, you just gotta believe in yourself. Anatomy of the musculoskeletal system. So synovial joints, they move freely, filled with lubricant known as synovial fluid. Inflammation is known as bursitis. Non-synovial joints are united by fibrous tissue or cartilage. So think of, with synovial joints, they're going to be your typical shoulder, elbow, knee, ankle, things you normally use. Whereas non-synovial joints will be other joints. 4 signs that suggest acute inflammation in the joint. You have swelling, heat, redness, and pain. Dislocation is displacement of a body part. Think shoulder. It has a lot of synovial fluid, but not a lot of cartilage, so it's very flexible. But because of that, it comes with the downside of being very flimsy, not very strong. Subluxation is partial dislocation. Think of dislocation with an X, subluxation. Contracture is abnormal shortening of muscle tissue. Ankylosis is highly resistant to stretch. Joint said, nuh-uh, not today, buddy. And that's caused by rheumatoid arthritis and immobility. So developmental competence, the bulk of this video. You're going to find this on page 609. This can be found on page 609 to 616. So you start from infants and you go all the way to elderly. Infants, you're going to want to examine fully. Start with the feet and legs and work your way up. Note any positional deformities. Babies' feet can often not hang flat. They can be varus apart and valgus together. So they swing sort of like a ship at an amusement park. Varus out, valgus together. Note the relationship of the forefoot to the hindfoot. The forefoot may angle inward and normal until age 3, and that's metatarsal adductus. Adductus, the D's are together, so the feet are together. And that's going closer to your 0 position, or closer together. Tibial torsion, twisting of the tibia, which means the leg isn't exactly straight at the shin, because the tibia and the fibula make up the shin. Hips congenital dislocation is dysphagia. The Alice test is used to check hip dislocation by comparing the legs' length at a centimeter apart. So that's the Alice test. Hands and arms, inspect the hands, noting shape, number, hand position, because you just might find an extra finger. Fun. Then you're going to want to lift the baby by the back. If they're 2 months old, they can hold their neck up. They're just going to hold their chest by this and let the rest of their body just kind of dangle on your arm as you inspect the back. So they should be absent of any tufts of hair, dimple in the midline, cyst, or mass. By preschool age, you should be able to walk to mama, dada, or legal guardian. And note the back while standing. Note the posture. Shoulders should be about 1 centimeter within, and they should be symmetric. Legs and feet, anteriorly, note the leg position. Bow-legged stance, Genu varium, and Genu varium is normal for age 1. This resolves with no growth or treatment. Knock knees, which is knees just angling away from each other about 2.5 centimeters if you compare 1 centimeter apart. Normally occurs between 2 to 3. No treatment needed. See page 613 for the bow and the knock knee. Check range of motion, and absence. So moving on to adolescence, you can proceed with the normal muscular exam as you would with an adult. Check for scoliosis, or else the U.S. Preventative Serious Task Force will be mad at you. They'll scold you. And they'll be like, why didn't you do that? Like, you're a bad nurse. Like, why did you go into nursing? Well, I assume it. So then you're going to ask the person to lean forward and touch their toes. If they can't touch their toes, that's okay. Just make sure their spine is straight while they bend forward. It's a scolio check, fam. So the pregnant mama, they waddle, and that's okay. Penguins waddle, am I right? And they're pretty darn adorable. Expect protruding shoulders, anteriorly, because they've got like 20 pounds of weight on their stomach, and they're gonna lean forward. I would lean forward too. So then the aging adult, it's about to get real. Pause if you want to or whatever. Kyphosis is common. A backwards head tilt to compensate. Kyphosis is the inwarding of the shoulders forward. So the get up and go test is, just do it. Nike. Can you rise up from a chair, walk 10 feet, turn, walk back, and sit down again? A healthy adult over 60 can manage this in fewer than 10 seconds. It's the 60s equivalent of a 100-yard dash. Functional assessment, how are you with ADLs? For further, ask them, can you walk? Can you sit up in your chair? Can you pick up objects from the floor without pain? Can you rise up from a chair? All right, and that concludes this video.